Narcolepsy is a neurological disorder that results from your brain's inability to regulate your sleep-wake cycle. Two of the classic symptoms are excessive daytime sleepiness and cataplexy. Cataplexy is the loss of muscle tone that's triggered by strong emotions such as laughing or anger. The muscle tone loss can be very dramatic, such as collapsing to the floor, or it can be very subtle, such as just a slight facial droop. When we talked about the sleep cycle, we talked about how a normal cycle goes from light to deep sleep to then REM. With narcolepsy, people have REM sleep just intrude into their wakefulness. So they can be awake and talking and suddenly become overwhelmingly sleepy. When they fall asleep, they go immediately into dreaming. On the surface, it can seem as if people with narcolepsy are sleep deprived, but typically they're not. They usually get an adequate amount of sleep, but they can't control the timing of their sleep. So what are some other signs of narcolepsy? Hypnagogic hallucinations. That's a weird experience that happens at sleep onset. You can see bizarre and vivid images as you're transitioning from being awake to being asleep. Another sign of narcolepsy is sleep paralysis, and it usually occurs with the hallucinations. Because your body is normally paralyzed when you dream, and this is called REM atonia, people with narcolepsy can get sleep paralysis at odd times of the day when they fall asleep. The paralysis usually lasts a few seconds to a few minutes. Because the paralysis and the hallucinations occur at the same time, it makes the whole experience of falling asleep very creepy. People without narcolepsy can experience hypnagogic or hypnopompic hallucinations as well. Hypnopompic hallucinations occur during the transition from sleep to waking up, and it can be accompanied by significant sleep inertia and even confusion. You may have seen someone close to you wake up confused and talking without making any sense for a few minutes until they fully wake up. If you ask them about the nonsensical stuff they were talking about, they probably won't remember anything they said, or at least won't remember the content of what they said. They may remember speaking. Let me tell you about a few other freaky experiences that you can have with sleep paralysis. Sometimes you can feel as though there's a presence in the room with you. You can feel chest pressure as if someone's inhabiting your body, or have the sensation of floating above your body, kind of like an out-of-body experience. It's been thought that these experiences may be responsible for some people's believing that they've been inhabited by an alien. Other symptoms of narcolepsy include choppy sleep, nightmares, and leg jerking. How is narcolepsy diagnosed? Your doctor may suspect narcolepsy from your symptoms, like some of the ones I described above, but it's definitively diagnosed from a sleep study. A couple of the tests performed would be a polysomnogram and multiple sleep latency test. The polysomnogram measures your muscle activity, breathing, and brain activity. The sleep latency test measures your time to fall asleep. A normal sleep latency is 15 to 20 minutes, 30 minutes max. Narcolepsy is diagnosed with a sleep latency of less than 8 minutes and the presence of 2 sleep onset REM periods. So with narcolepsy, you must show on testing that for 2 times you go straight from awake to REM. The treatment for narcolepsy is basically managing the symptoms to make people more functional, because the inability to control your sleep timing can be very debilitating. These people can fall asleep while sitting in a red light. So the treatment involves medication plus behavioral strategies. The gold standard treatment is a medication called Xyrem, or sodium oxybate. This medication treats the daytime sleepiness and the cataplexy. Sodium oxybate is related to the drug GHB, or gamma-hydroxylbutyrate, also known on the street as liquid ecstasy. Now don't get scared. GHB is illegal, but sodium oxybate is not. If you still have daytime sleepiness with the Xyrem, your doctor may add a stimulant such as Provigil or Nuvigil as both are designed to help people with narcolepsy be more alert. Sometimes antidepressants are used to treat the cataplexy, the hypnagogic hallucinations, and the sleep paralysis. As for the behavioral interventions, we usually recommend people take at least 3 scheduled 10 to 15-minute naps during the day to help with the sleepiness. It may also prevent the sleepy episode from occurring by essentially beating it to the punch with a scheduled nap. This way, you're sleeping on your terms and not having it creep up on you while you're at a traffic light. So that's narcolepsy. This usually develops in late adolescence to early adulthood. It can go undetected in many people for years, but if you are just now at age 50 having trouble staying awake during meetings, it's probably not narcolepsy. In the next lecture, we'll discuss movement disorders that interfere with sleep.